Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of Dr. Ashley and the Boss.
Good morning, boss.
How are you doing, Dr. Ashley? Yes, we always have a special guest.
We do.
Before we get on to our special, how are you doing?
I'm doing pretty well. How about yourself?
Well, spring's in the air.
It is. I love that.
Right?
That helps.
I don't know when folks will be listening to this, but at the time we're recording, the weather's getting very nice.
It's lovely.
You're right, Dr. Ashley. Do you want to introduce the name of our special guest today?
Yes, our special guest today, we have Jerry Strausbaugh, Director of Appleseed, in the studio. So that's really
Welcome,
exciting.
Jerry.
Thank you. Good to be here.
Thanks for taking some time out. As our listeners know, we have been going through a series of interviews, getting to know our Mental Health and Recovery Board members. We've talked quite a bit about what boards do, where they exist in Revised Code, Chapter 314, which, if you haven't read that yet, I encourage folks to do that. In addition to our board members, we wanted folks to know about our directors. So these are the contract partners that we have, Appleseed, Acada, and Catholic Charities. Each one of those directors we think are important people that you should know about, and we've asked the directors in to talk not only a little bit about themselves, but the programs and services that are offered, and of course, how to get a hold of them if you're interested. So Director Strausbaugh is well known, I think, to the Ashland County community, but Jerry, just assuming there's somebody that just moved here, Ashland County hasn't had a chance to meet you yet, maybe tell us a little bit about yourself, maybe how much time you've been in the area, education experience. Sure. I think just lay the groundwork.
Okay, thanks. So I grew up actually not around this area. I grew up in Athens County in a small town called Albany, and wound up going to Ohio University for my undergraduate degree and received a degree in special education a little while ago, and was actually a school teacher for about 3 years. But what I found was that I really enjoyed helping kids with problems and issues and who were struggling not just academically, but also emotionally and with their families and those kind of things. So I took a career change, and that's when I moved to Ashland. In 1990, went to the Ashland Theological Seminary, has a counseling training program. I went there and finished up my training program with them in about 1993. Worked briefly in a private practice, and then wound up working in a psychiatric hospital for about 5 years, and really enjoyed that work. But then found my way into community mental health around 1998, and just fell in love with that area of mental health and that work, and came to Appleseed in 1999 and continued my love for community mental health, just the kind of folks that we get to help and serve and the kind of programming that we get to do. And so have worked in that field for a long time. Personally, married to Jane. We've been married since 1989. We have 3 adult daughters, and now since January of 23, we have 2 identical twin granddaughters.
Wow.
So, wow, that's awesome.
Grandpa Jerry,
Yeah.
this is great.
Grandpa Jerry.
Yeah. Well, that is wonderful. Thank you, Jerry, for sharing that.
Yeah, so we also want to know how long you've been with Appleseed and how many years kind of in your current position.
Sure, yeah. So I started at Appleseed in 1999 as a counselor for children and their families. I was hired on as a counselor for kids and families. Really enjoyed that work. And then shortly after there, probably around 2001, the agency created a clinical director position for our programming for youth and families, and I was able to move into that role, and then did that for about 3 years. Then in 2005, when our agency moved from a couple different locations on Cottage and Claremont Avenue, we moved to our current location, 2233 Rocky Lane. We moved into that building in April, and our executive director at the time resigned shortly thereafter. And I thought, somebody's going to get this job. We won't know if they'll be good or not. So I just applied, not really knowing what I would be getting myself into, and was hired by the board to be the executive director then of Appleseed starting in July of 2005. So,
Wow, that's awesome. I love doing this because I didn't know a lot of that history about Jerry.
Well, I have to
cool.
assume some of our audience did not know that. So
Yeah.
let's do math. There's three of us and we went through counseling programs, so we're not good at math. So 99, 2024. I think that's 25 years
yeah,
you've been
I've
there
been there
with
about
them.
25 years. Yeah.
Wow,
It's hard to believe.
that's
You
pretty
just
awesome.
start somewhere, and the next thing you know, 25 years later.
Yeah, I didn't know you were a counselor there. So
Yeah.
that's how I didn't know that. That's
Yeah.
so cool.
Well, I like the idea that he was a teacher. I think
A teacher,
he'd
yeah.
be a great teacher. I would take a class from
Oh, yeah.
Dr. Jerry Strausbaugh.
What did you teach?
So I was a special education teacher. I
Okay,
taught
cool.
at a middle school.
Nice.
Yep. So
Well, since you've got all this history with Appleseed, again, I don't want to assume the audience knows a ton about your organization, although I suspect several of our listeners do know. But maybe tell the audience what you want them to know about Appleseed as an organization, maybe mission, purpose, things of that nature.
So we are a mission-driven organization, being a nonprofit. Our mission actually is to help people live healthy, whole, productive lives, and we do that through the services that we offer. When I'm talking about Appleseed, I say that we have three areas of programming that we do. The largest by far is behavioral health. So we have around 110 employees. Probably 2/3 of those are working in some capacity in our behavioral health side of things. But we also have a domestic violence shelter and sexual assault program. And so, and those are kind of two distinct funding sources, but the programming really blends together. So we have a shelter, we have advocates in the community that work in the court system, at the hospital, that we have people that go to the schools and do education and training, community advocacy. We have actually a staff person that works on site at Ashland University. So that program is, even though it's a smaller program, its impact in the community is very large. And then the third thing that we do is housing. We have a number of housing grants that pay rent for people who are homeless or not housed well. And so that's another area. We have case managers and grants that we help people get into the right housing for themselves.
That's great.
Yeah, that's awesome. Could you share about maybe 2 or 3 programs and or services that you would like to spotlight on the podcast today?
Yeah, so one of the things about Appleseed is I would call us in the world of community mental health centers, kind of a mid-sized community mental health center. The budget for our agency is around $7 million. As I said, we have 110 staff that do either programming in behavioral health or the safe haven programming or housing. But when I think about some of our programs, of course, we have a large number of behavioral health counselors, case managers, psychiatry, emergency services, but some of our more unique programs that I think really serve a small population but have a huge impact. I think about one called START, which is a program that we partner with our local job and family services for. And our role in that program, which is a program for parents who have lost their children or who may be going to lose their children or jeopardy of losing their children because they have drug and alcohol problems. So we partner with Job and Family Services to have a START parent mentor. And this person is a peer mentor. So this person is a position that it was hard to hire because the qualifications are so unique. You had to have had experience with Job and Family Services. In other words, you had to have jeopardy with your own children and recovered from that, gotten through that and doing well, and also addiction recovery.
Yeah.
So we had to find someone who could meet those two criteria and then now is well on their road to recovery and is a trained peer mentor. And so that's one program that really helps that START program be successful. So we work closely with them. We have a peer mentor serving at Job and Family Services. Their office is there.
And Jerry, just before you go on to your next program, congrats to you on, because I know, this isn't the first peer mentor that you have hired, and even hiring one is a challenge. So, congrats to sticking with it, because as you say, someone with that unique experience and skill set, they're not easy to come by, and certainly in Ashland County, where some of the bigger metro counties are also hiring for this START program. So,
But our staff there does a great job, and we're blessed to have that partnership. Another unique program that we have that, again, serves a smaller population but I think has a big impact, and it's one of the programs we partner with the Mental Health Board on, is our juvenile court parent mentor. So this is a newer program paid for by our SOS grant, or it used to be SOAR grant dollars. And this person works specifically with families that are referred by the judge, by juvenile court, to help the parents gain the skills they need to just be a safe place for their kids to live, so they're less in jeopardy of losing their kids. So that can be learning how to do a better job cleaning your house, getting groceries, navigating the court system, whatever those parents need in terms of life skills, parenting skills, just the kind of things it takes for people to live life successfully and safely in the world. That parent mentor helps them gain those skills.
Yeah, that's awesome. That's a great program. Anything else you want to spotlight? You guys have so many things going on.
Yeah.
I know we limited you a little bit.
Yeah. So two other things I was going to mention. One is a really small program, our Spark program, which is it's a small program for parents of 4-year-olds to help their 4-year-olds get prepared for kindergarten. It's a parent mentoring program where we help the parents through teaching them how they can then work with their kids to help them learn how to read, problem solve, manage their emotions. So it's only a program of about 30 families at the most. We have 3 part-time staff. It's not a program that's directly funded, like there's no, it's not a Medicaid billable program or anything like that. So we have a little bit of an earmark from the state. We have United Way funding, and then Job and Family Services partners with us and made it part of their PRC program. So if families qualify financially, they can help support it. It costs about $1,000 per family, but they have about 12 lessons that the families go through over the course of a school year with the parent mentors just side by side with the parents. So that's a cool program.
Yeah.
And then, of course, our school liaison program, which I need to highlight the board through the levy, Ashland County Mental Health and Recovery Levy, which is really an important funding source for the board, but just really funds the liaison program. We're able to have school liaisons in all the city and county schools in Ashland, and they do everything from helping families find food resources to helping with disciplinary issues or liaisoning with juvenile court or JFS or any of the programs, making referrals to health care, mental health care. But that's just a really great program that's been around since I think the year 2000.
Yeah.
And that's another just really cool program. I always say when I talk about Appleseed, 2 things I always like to say. One is we are only as good as our team members, and we work really, really hard to hire and keep the best staff we can, because that is who's working with people, and that's who the agency is who you're working with. And the other thing we try to be is the best partner anybody could have in the county. So we work extra hard at partnering with the hospital, with juvenile court, with Job and Family Services, with the mental health board, with the schools, to be that agency that they can count on when they have a need that's in the realm of the services that we provide. We just really work extra hard to be a great partner. So.
Yeah. And to that point, let me just say, and Dr. Ashley, I don't think a lot of folks listened to my origin story that you did with me. I know you did a great job, but nobody was interested.
I think they were.
So I will just say that I've been with the board for 20 years, and I've known Jerry that entire time. So when he talks about partnerships, I want our listeners to know. That's real. So the board has been contracting with Appleseed for more than 20 years, obviously. But, just having the continuity, Jerry, Stacy Merriweather, one of his key staffers and in charge of the liaison program. I want the audience to know that we've been partnering with these agencies over time because they're consistently doing good work. They're very responsive to the changing needs that our county has seen over time. And I just have appreciated Jerry, his board, and his staff, weathering ups and downs over those, just the time I've been here, which is substantial, but still, that means a lot. So I know I've heard you say that before, Jerry, about we need each other. We do try to have these productive relationships. I've been asked from time to time, why doesn't the board change their contract partners on a regular basis? And, I could unpack that and take a lot of time, but primarily is because our partnerships are so good and they're so responsive to the needs that the board needs to meet, that we don't have to look elsewhere for other folks. So we appreciate that ongoing partnership, and that leads into this next question, which is an interesting one, and I'm real curious. I think I know what you might say, at least in part, but even prior to the pandemic, I think the community behavioral health system, you and I talked about this, Jerry, over the years, was experiencing some challenges. And then, the pandemic hit, and we all did our best to work through that. And I think we did a great job adjusting. But, the world changed during that time. And as we came out and now are out of that, the whole community behavioral health landscape has changed, and there are some interesting challenges, some of which we kind of saw, but other things that just emerged. So from your seat, your perspective, Jerry, what are some of the challenges that you're noticing, either Appleseed specifically or just in general for community behavioral health?
Yeah, well, thank you. And thanks for what you said about our partnership, and I agree. And also just say a shout out to ACADA and Catholic Charities. We work well with them as well. But I think, when I think about challenges, certainly COVID was an interesting challenge. When the shutdown happened, we had to pivot immediately to telehealth care for the most part. Our case managers work in the field, and they aren't in office very much, but our counselors are often in the office, and so they had to pivot to telehealth. All of our services did. So that created some unique challenges. But then I think coming out of COVID, certainly I think what we see is just we live in an anxious and an angry society, and I think that COVID didn't help that. So we continue to, on the emergency services side and other work that we do, just continue to see, though, the numbers go up and down as far as people calling, monthly and those kind of things. But the kinds of issues we see certainly, I think, are more intense and more acute, and those things that people are dealing with seem to just be more pronounced. I think as far as challenges for us as an organization, aside from just the work that we do, which can be, difficult and takes a lot of training and a lot of specialization, which we work really hard to make sure our staff has. Workforce is a problem. Hiring staff that fit our culture, that want to do a good job, that want to serve the clients that we work with. I always say in interviews, there's 4 things people have to be to work well in community mental health. First and foremost, you have to love our clients. You have to really have a heart for the kind of people that we work with. And beyond that, then if you're flexible and efficient and focused, you'll be okay. So, but we're trying to hire people to work in our supported employment program, our housing program. So some niche kind of positions, but then just in general, case managers and counselors, just trying to find not just anybody, though. We really work hard at vetting people that we interview, and so finding the right people, that's a struggle. Just as an agency, costs that we have, the ongoing growing cost of health insurance for our staff, that's a struggle that we try to be creative with and manage, and are always looking for innovative ways to manage that. The needs of the community, as I mentioned, just, David, and Ashley, that we just are always trying to serve partners like the jail, but they have huge needs. So how do we meet their needs? The hospital with crisis interventions in their emergency department. So those are some of the challenges. And then lastly, I'll talk about the managed care organizations later. But I would say those are some of the bigger challenges, just meeting the needs of our partners that are continuing to escalate, and then our own workforce and costs that we bear as an agency and as an employer.
Yeah, those are really great points, and I think it really is remarkable, all of the services that Appleseed offers to the community and all the ways that you interact with the community. Like, there really are a wide array of services.
Absolutely.
So, what opportunities do you see for your organization, Jerry?
Being a community behavioral health provider, which the definition of that has changed over the years that I've been in the field. It used to mean that we were a partner of the Mental Health Board, and you were our primary funder for Medicaid and non-Medicaid dollars and everything. But I always go back to when John Kasich was governor. He elevated Medicaid from boards and created the Department of Medicaid. And so what that's translated into is that system has matured. more and more managed care organizations coming in, insurance companies that are managing the cost of people on Medicaid. So that can be something that you complain about, or it can be something that you see the opportunities in. And certainly, we've been blessed to be part of a network of agencies that work really hard at negotiating with the managed care organizations, because we know we provide a unique service. We work with individuals on that health insurance that have a lot of needs and that often are high users of health insurance. And so we provide the kinds of services that can help them manage better their health and their social determinants of health, such as housing, having friends to hang out with, those kind of things. So we believe we provide a real service that the managed care organizations can benefit from, and we're working hard to negotiate with them. And that's an opportunity for us to be that provider. New models of treatment that are coming out of managed care, they want to see their members, they call them, have the best health care and the best outcomes. So things like intensive home-based treatment, mobile response services, and other kinds of opportunities for best practices. We see an opportunity there when there's grants and those kind of things that come out. So, and then just in Ashland, continuing to find ways to partner with the people that we serve, the people that we consider our partners, I guess, would be the opportunities that we see.
Yeah. No, that's great. And we are in studio, Dr. Ashley and I, with, and we should have said this, Dr. Jerry Strausbaugh.
Dr. Jerry.
We didn't mention that Jerry as well has his PhD, and I don't think you told the listeners, Jerry. Tell us a little about your PhD.
Mention that, yeah. So in 2005, when I became the executive director of Appleseed, I was a licensed counselor, had a training in mental health. And, I went into that job pretty innocently, pretty naively, thinking, well, just be nice and everything will work out. So, but, you quickly find out that there are a lot of forces in an organization. They're internal politics, external politics. They're just managing the money of an organization, the dynamics of the staff. All those things are quite overwhelming. So I just felt ill-equipped for that. So there was an opportunity for me to go pursue a doctorate degree in organizational leadership, and that's what I did. I felt like I could learn some things that would help me do a better job, and I think that did help me be able to see an organization in a little bit different light. It's interesting. There's a fair amount of overlap in a degree like that and a behavioral health degree, especially in the family systems research, because there's organizational system theories that very much align with family systems kind of work. So, but so I did pursue that and graduated with my doctorate in organizational leadership, I think, in 2013. So
that's great.
Nice. That's awesome.
See, two doctors on the show. We don't often have that.
Yeah, that's great.
Dr. Ashley and Dr. Jerry. And again, because I do get this question from time to time from members in the public, so does Ashley. I encourage folks, if they go to an agency like ACADA or Catholic Charities or Appleseed, oftentimes as you're in therapy, case management, any of the services that are offered, every once in a while, there's not a good fit between the helper and the person that's coming in for services. And I think I just want folks to know that that's okay. As an ex-therapist myself, I can tell you I did my best to fit as best I could and meet the needs of the person in front of me, but I always couldn't do that. And I just want audience members to know you can always ask for a transfer or somebody else. Right. I don't want folks to give up, and I don't want families to give up on our system just because that maybe that initial connection isn't as expected or as strong as you want, because our agencies employ, as Jerry said, a lot of different staff with different personalities and different backgrounds and different training. So don't give up. At least try if there is some struggles. But I know your staff, having talked with many of them over the years, Jerry, I think I always start from the assumption that they're doing this work because they care about the people, just like you said. So, I just ask listeners to recognize that from the get-go, that these are workers, whether it's ACADA, Appleseed, or Catholic Charities. They're there because they're passionate about helping, and they're going to do their best to do that. And if they feel like, hey, maybe they're not in the best position, they will refer you to either somebody internally or even externally if they have to. So, well, Jerry, we're at that point in the
broadcast where we just ask you, is there anything else we should have asked you that you'd like to tell the audience about Appleseed Community Mental Health Center?
You know, there's certainly a lot of programming kinds of things we could talk about. I came from a meeting that Dr. Ashley was at this morning, and I mentioned just real quick, we're always trying to find funding sources for little programs that meet the needs in the community. And so there's one we were able to get a community foundation grant for. It's a kinship caregiver group.
Oh.
There's a phenomenon that's really been growing over the years is grandparents raising their grandchildren.
Yeah.
And so this is a support group that meets on the third Wednesday of the month at 5:30. At Appleseed, it's a group for the kinship caregiver to just. There's some structured. No, it's pretty unstructured. There's a little bit of maybe some information given at the beginning, but then it's just an opportunity for folks to talk. But then more recently we've been able to zoom in a group of Loudonville caregivers as well. They meet at New Hope Church. Both groups have a meal and child care provided. That's going to run at least through April. We're hoping to find some way to extend that, but March 18th and April 15th at 5:30. If you would be interested, certainly reach out to the agency and you'd be able to be part of that.
Well, that's great. And Dr. Jerry, thank you for your time
Sure,
today.
thank
We've really appreciated it, and
Yes, thank
we
you so
will
much.
have you back on
Okay.
at another time
you.
as well.
Yeah.
Thank you.
Yep.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.